It gives me enormous pleasure to be able to present to you this inaugural session of Gratitude Week. This gratitude is for all those healthcare workers who are risking their lives to provide care and cure for us during this pandemic. This is the tribute for all our doctors and nurses and other healthcare workers who have become the only resort to our species battling one of the most fearsome pandemic of all times in form of COVID-19. We are honored to have some of the most distinguished healthcare leaders with us to make this occasion even more special and historic. Let me begin by introducing someone who is among the most prominent face of our fight against COVID-19. Dr. Randeep Guleria, Director of India's largest public healthcare facility, the All India Institute of Medical Sciences, AIIMS. While he's leading our public healthcare response to this deadly virus, he has also been going the extra mile to ensure that every person gets accurate information and medical advice to protect themselves from this disease. Welcome, Dr. Guleria, for joining us today on this occasion. We are also privileged to have Professor K. Srinath Reddy with us, President of Public Health Foundation of India, an internationally acclaimed public health visionary. Dr. Reddy has served on many WHO experts panel and has been President of World Health Federation as well. He is an adjunct professor of epidemiology at Harvard. Welcome, Professor Reddy, for joining us today. We are also going to have our partner and supporter in this initiative, Dr. Dinesh Batra from Ujala Cygnus Hospital. And we have with us our partner and all-time champion of women's health, Dr. Hema Divakar. She is one of India's premier gynecologists and head of Divakar's specialty hospital in Bengaluru. She was the head of the Federation of Obstetric and Gynecological Society of India. She is also chairman and CEO of ARTIST, that stands for Asian Research and Training Institute for Skill Transfer. With us also we have Dr. Prakriti, Poddar, one of the most passionate ambassador of mental health, who has consistently striving to spread awareness on and sensitivity towards mental health. She is the managing trustee of Poddar Foundation, which is dedicated to creating a better support system for mental health. And so let me begin today's proceedings. And we will be expecting our Honorable Minister of State for Health and Family Welfare, Sri Ashwini Kumar Chaubey, sometime soon joining us. And till the time, let's hear some of the words and the experiences and guidance of how we are fighting this pandemic, how our doctors are toiling hard on the wards of COVID-19, risking their lives, from somebody who is leading this fight from the front. Dr. Randeep Guleria, kindly enlighten us with your experiences and how as a society we can support our doctors at this time.
Thank you very much, and it's an honor to be with such a esteemed panel, and I would like to take this opportunity to wish all my fellow colleagues a very, very happy Doctors' Day, and especially remember those who have given their life for the cause of COVID-19. We should remember them all today also. As we battle through COVID-19, these are challenging times. For many of us, it's what we call once in a lifetime or once in a generation experience. We all talk about pandemics, but when you really have to live through a pandemic, it's a huge challenge. I, for one, have been talking about pandemics from late 90s to early 2000 when we had SARS, and before that we had a small outbreak of what was known as H5N1, and been working on seeing how we can have outbreak management from that time till the avian influenza, H1N1, MERS, Ebola, Zika, and then we've had now the COVID-19. It's a challenging time for all of us. And I think it's also raised that issue that although we are talking a large, that we are seeing a huge burden of disease as far as non-communicable diseases are concerned, infectious disease come back with a bang at times, to really make you aware that you still have to have a huge preparedness for pandemics and infectious disease. When we talk of the risks that we have, and this is something which has come up with COVID-19, when I talk to the doctors, the nursing staff, the fear and the panic that they had in the initial days. I still remember one nurse who was so scared even to go home because she thought she would carry the virus with her to her family members and infect them. And the panic that we had in the early days actually reminded me uh, of what I had seen as in almost 2 decades ago when with the HIV epidemic or outbreak, where there was that type of a panic and even hospitals were not willing to admit patients or do deliveries who were HIV positive. So medicine itself has an inherent risk for all healthcare workers, and that is something that all healthcare workers accept. Doctors accept it as part of their duties, and very often they feel that this is part of what we call an occupational hazard. And patient care is paramount despite the risk that they have. And they would see patients knowing that they are infectious, they can give them the infection, and still continue to do that because what really matters is that if you cure a patient, the smile on a patient is something that is what doctors really yearn for. But and we have had patients, many of my residents in faculty, because I'm in pulmonary medicine, have had tuberculosis. Some of them even have had MDR, TB, and they've all accepted that this is a risk. But this is an unusual time where the risk is at times a little bit higher than what had been previously thought of, and the magnitude of the risk is sometimes over emphasized because of it being a new virus and uncertainties being with there. So I would really say the doctors have actually risen to this challenge in this unprecedented times, and that is something which is very heartening, not only in our country but at a global level. Doctors who have come out of retirement to really help in fighting this pandemic, despite knowing that they come into the high risk group. We've had our own senior professors who have actually joined back work and started working in COVID areas, knowing, accepting the fact that this is, they are at a high risk, realizing that this is something they have to do and this is part of what medicine is about. But also there are issues that we need to really understand what the residents and doctors want. And I think for policymakers, for all of us, the public at large, these are issues that we should really address. Some of them are what was very nicely brought out in a recent article. That one issue that they want is that they said that please hear me, hear my concerns and try and address them. That is number one thing that we should try and look at. The other is protect me from the infection, give me enough protection so that I am assured that everything is done to protect me when I go into this battle as a warrior, that I have enough protection. The third is prepare me for the fight that I have to do in terms of training, in terms of hospital infection control practices, in terms of managing these patients so that I feel confident that I can do that. And then support me in all of these activities. And that is very important because unfortunately, with COVID-19, there was a lot of stigma attached and a lot of doctors had to face a lot of problems because of this stigma. And therefore, that supporting part also, I think, is very, very important. And then the other issue is the final issue is care for me, that care for me and my family members if they are having to go through this stress or the infection, so that they feel that no matter what, everyone is there to really look after them. And I think this is something that we need to really keep in mind as, let's say, the leaders or even policymakers need to keep in mind if we need to keep the morale of our young doctors and the healthcare workers high. Modern medicine has given us a lot. We've learned, we have really changed how we practice medicine. There is so much to offer in terms of technology. Yet, the pandemic has also taught us that we really need to also go back and be prepared for the basic things. For example, basic population-based intervention still continue to be the most important method that we still have to fall back on when it comes to infection control. So whether it be social distancing, whether it be isolation, quarantine, closing down schools or having some sort of a lockdown, or whether it be cough etiquettes, wearing a mask, all of these basic population-based interventions become more and more important, because despite all the technology that we have, we really don't have an effective treatment or a vaccine currently as far as COVID-19 is concerned. So I think that is another important point that I wanted to make, that it's important to really be strong on the basics and rather than just looking at everything from a technology point of view. The other thing that I wanted to say finally was that no one is an island. And this is something that the pandemic has really taught us, whether it be governments, whether it be countries, whether it be public sector, private sector, everyone has to support each other if we have to fight this battle together. And therefore, if we have to win this battle as far as COVID-19 is concerned, everyone, including the public sector, the private sector, and other people have to come together. Could be medical fraternity, it could be non-medical fraternity, it could be policymakers, because it has to be a team effort and each one has to be supportive so that we work as one in terms of fighting this pandemic and are able to really come through successfully. The next few months or the year or two are going to be challenging because we are going to really have the whole issue of a new normal. How are we going to really start opening up the hospital with this background of fear of pandemic? Uh, Unlike HIV or others, this is a much more infectious disease. And therefore, the whole challenge that doctors have is that if I start routine surgeries, how do I know that this patient is not in the incubation period of COVID-19, and what will happen if I operate and subsequently turns out? How do we upscale our supply demand, our hospitals for PPEs and protective gear when we start opening our routine OPDs and routine services? And how do we really develop a long-term public health response when it comes to managing these pandemics? In the beginning, I mentioned the number of outbreaks that I've seen over the last 20 years. It really drives home the fact that as the world becomes smaller, we will see more and more of such outbreaks happening, and they will travel from one part of the world to the other very quickly. And therefore, we need to have a long-term plan if we are still going to see more and more such outbreaks coming. Ebola for a long time was only limited to Africa, but it traveled all over, and there were cases reported even in the US. SARS traveled from Hong Kong all the way to Canada and led to a huge outbreak with a lot of healthcare workers getting ill in 2003. So I think we have to prepare both for a new normal post COVID and how are we going to tackle subsequent outbreaks so that we don't land up in a situation that we did as far as COVID-19 is concerned. That's what I like to say, but I'd like to again end by really uh, congratulating and actually saying that all healthcare workers and doctors have really done a remarkable job and really risen to the occasion as far as COVID-19 is concerned. Thank you very much.
Thank you so much, Dr. Guleria. Uh, you really brought out the real state of affair when it comes to our healthcare workers, how they are feeling, what they expect from our society, from the people around them, and from the people who are supposed to uh, create the right policies or environment for them. Dr. Guleria, we have also seen that, despite their so much of effort, it is a very sad state of affair that as a society, we have always seen a very, ever widening doctor patients or doctor public trust deficit for the past several years. And the relationship has been, kind of questioned for multiple reasons for, some time based on, the bad perceptions or, some kind of vested interest. But the relationship, which should be always founded on compassion, care, trust, and submission, has been questioned and maligned. So, when you say that as a society we need to be more, also, the four word which you, highlighted, that this is the time when we need to hear them, we need to protect them, we need to prepare them, and we need to care for them. I, would like to introduce to you something which we want to take up as a cause in ISW Council, and this is that, adding another word with that, that also remember me. And remember me, for all those doctors who have, kind of fallen prey to this pandemic while trying to save us. For this, Dr. Guleria, we are starting an initiative or a campaign to request the government of India and the entire society and the industry to help set up a gratitude memorial for the contribution, to remember the contribution and sacrifice of these doctors, nurses who have made their supreme sacrifice, but at the same time, all those who are making sacrifice every day by working hard. And this is an extension of what we saw, a national clapping or applause when the Prime Minister gave a clarion call to support our medical practitioners, our healthcare workers, and also what we saw as a showering of flower petals on our hospitals. We want that this is something which should stay in the heart of people for longer. And I would request that, I would like to hear if you endorse this idea that the way we see war memorials across the world, and which remind us to remember that sacrifice of our soldiers who fight and die at the borders. But this is the time, and not only this time, doctors have always been vulnerable for many infections. They have always been on the front line. When we carry infection to the hospital, they are equally vulnerable. They have always made, I think, some kind of sacrifice. And especially on pandemics, which you mentioned, in the last 20 years, there has been multiple pandemics or, epidemics which are, or endemics which are causing loss of life and destruction. So I would like to hear from you and your, kind endorsement and support for this campaign, which we are starting through public petition to request the government, once the things clears out, once we are settled back to our normal life, let's put together a gratitude memorial for our healthcare workers also. And this may be a noble initiative from the government of India.
So I agree with you. I think it's an excellent idea that we have a gratitude memorial. But I think it would also be good that that their sacrifice is not in vain, and we move forward so that we develop strategies and mechanisms that we are able to protect them better in subsequently, so that we are able to improve our healthcare system in a manner that we can decrease mortality later on if such things happen.
Thank you so much, Dr. Guleria, for endorsing this idea. But I do echo your sentiment that just the words or maybe memorials may not be enough. As John F. Kennedy once said, that we express our gratitude, we must never forget that the highest appreciation is not to utter words, but to live by them. And I think that is where the whole society needs to come together. The government needs to be more meticulous to put together a better health infrastructure, which not only support to the public, but to also support to the people who are working in that infrastructure, who are making that infrastructure really help or achieve the objective it wants. Thank you so much. I would like to go to Dr. Professor Srinath Reddy. His experience of public health globally has been remarkable, and I would like to hear that what Dr. Reddy's message is today for the people of India, as well as our healthcare community, who is working hard there. So on this Doctor's Day, as well as this new initiative of Gratitude Week. Dr. Professor Reddy.
Thank you very much. Greetings on the Doctor's Day to the distinguished panelists and to the dedicated participants. It will be good to sort of start off by paying tribute to the hallowed memory of Dr. Bidhan Chandra Roy, in whose memory and on whose birthday the Doctor's Day is observed in India. Different countries observe Doctor's Day on different days. But in India, we do it on the 1st of July, because that happens to be the birthday of Dr. Bidhan Chandra Roy, who was the distinguished architect of West Bengal, as the Chief Minister who is long remembered for his contributions. Dr. Roy, being a medical doctor, got his MRCP and FRCS in the UK and came back, and while being a practicing doctor, joined politics and became a Chief Minister who governed Bengal with great grace and distinction. But even while serving as the Chief Minister, he continued to provide free medical advice. He would still see patients. And the reason was, despite all that he was involved in politics, he derived his most immense satisfaction from being a doctor. That he regarded as the most fulfilling component of his life. And that speaks volumes of what the medical profession is and should be. You did say in your beginning and in the video that we are there to serve 24 hours, 7 days a week, 365 days a year. Actually, in this rather confusing year of COVID, it is 366 days. It's a leap year. And we are actually in this year serving every single day through the medical profession. But it is time also to remember that the reason why Dr. Roy felt that, and why we should also be proud of our profession, is that it is a profession which is a service, not a business. And here we use our skills to serve a social purpose. And we deliver competent, committed, and conscientious service, essentially for the welfare of humanity. And that is the ultimate pinnacle of the profession's values. But a doctor has to exhibit several characteristic attributes in order to fulfill that. Care, concern, courtesy, compassion, all these are essential elements of a good doctor. Communication too has to be an important element. And those skills are necessary to build the kind of trust that you have been talking about. So unless we actually engage adequately with people whom we are serving, share our knowledge to the extent we can, enable them to become informed participants in decision making, we will not be able to build that level of trust. Therefore, unlike the previous very paternalistic pattern of medical practice, now we are getting into much more of a partnership type of model in which there is a great deal of informed participation by the patients and their families. And even in COVID, that matters, because when we are looking at patients who are, whether they are to go into intensive care or whether they're going to be in home care, what kind of treatment modalities are available, all of these will also have to be shared with the family, because those are important decisions in the life of their family member who is unwell. Therefore, the role of a doctor in COVID-19 is now coming out in very sharp relief. We are seeing doctors becoming very important providers of care. We also see that they're doing this at great personal risk. Indeed, while we are told that age, in terms of advanced age, is a risk factor, and that generally younger people and even people in the middle age are generally better protected against COVID, we are seeing a number of young and middle-aged doctors and nurses still being affected. That is because of their repetitive exposure to high viral load. They are aware of it. Still, they will not shirk their duty. They look after hundreds and thousands of patients because they feel that is part of their professional responsibility. So I think remembering them and celebrating their contributions is a very important element, and I salute you for that idea. But we also recognize that there is a great deal of stigma which has been directed at them, which has been extremely unfortunate. And that stigma comes because the doctor often becomes the face and symbol of a failing health system, which is underfinanced, underprovided, and therefore whatever inefficiencies are there in the system which the doctor himself or herself is battling day in and day out, unfortunately, those inefficiencies stand starkly in front of the dissatisfied community, the patient's family, and they hold the doctor responsible for what is essentially a failure. To correct the failures, and we'll come to that. But certainly, COVID has also brought about a lot of other changes. Dr. Guleria spoke of the new normal, not only in the lives of the individuals in the country who are going about their lives after the lockdown, but also even in the medical professional's life. Telemedicine, which was not considered to be legal before COVID, now has become legal. Teleconsultations have become more of the norm, particularly chronic patients. We're now talking about how do we actually bring in artificial intelligence into diagnostics. A lot of new changes are happening because of COVID. But recognizing that with all the advances in technology, the doctor remains pivotal. Even artificial intelligence has limitations unless the doctor uses discretion and experiential wisdom to try and find out what the context in which that knowledge has to be applied, because context matters. And therefore, the doctor, even with all the advances in technology, will never become dispensable or diminish in the life of healthcare. And therefore, while we adapt and adopt new technologies, we have to remember that the medical profession remains absolutely a profession that is pivoted on professional competence and professional dedication of the doctor. However, we must also remember on Doctors' Day that doctors are not fighting this alone. The whole healthcare profession is a teamwork. We work not only in teams of doctors, but we work with nurses, we work with technicians. And while the tribute today is being paid to the doctors, we should also salute the nurses, the technicians, everybody else who is involved in healthcare provision. And we have to build up that spirit of teamwork. We have to dismantle the false hierarchies that exist sometimes in the medical profession. We have to remember that we are all working in it together as a team. And therefore, today on the Doctors' Day, I reach out not only to salute my fellow doctors who are providing human service, but also everybody else who is now supporting the medical profession in providing the kind of healthcare that's required. But coming back to the system, why is it that we have people with non-communicable diseases likely to fall more prey to COVID-19? Why is it that hypertension, diabetes, coronary heart disease, chronic respiratory disease have generally remained relatively underdiagnosed and undertreated in the country? So where is the health system failing? What is happening in primary healthcare, which Dr. Guleria rightly pointed out, is absolutely pivotal. So these are all the things also that we need to examine. We need not examine only what happens when a patient actually lands up in intensive care. Where did the disease begin? Could it have been prevented? Could we have had a stronger public health system, a better primary healthcare system? And the whole area of universal health coverage. If there is a system failure for which the poor doctor is being held responsible, what are we doing to do the correctives in the system? How are we actually increasing the amount of public financing in terms of expanding our health workforce? We are short of basic doctors and specialists. We are short of nurses. What is being done to correct that? Instead of just letting a few people battle it out, how are we actually expanding our skilled health workforce? How are we actually providing more infrastructure at the primary healthcare district hospitals and even medical college hospitals? So this brings us to universal health coverage, public financing issues. So instead of just saluting the doctors today and forgetting about them in the rest of the 364, 365 days and leaving them to fight the inefficiencies of the health system, I believe it's necessary for us to now also become advocates. Doctors play multiple roles as healers, educators, elucidators in research, policy enablers. We see Dr. Guleria, Dr. Paul, and others supporting the policy of the government on COVID. We also have to become advocates for system change, for universal health coverage. And I believe that will be the real game changer, apart from the tributes that we pay to the doctors. And therefore, Dr. Guleria himself He is the convener of a special high-level group set up by the Finance Commission in order to look at how much of financing is required for health in the recommendations of the 15th Finance Commission. May I urge you and all the participants here to write to the Finance Commission asking for greater public financing for health for the center as well as the states. May I urge you to write to the Parliament members asking for greater financing and strengthening of the healthcare system so that we'll have more doctors and nurses and other skilled technicians, so that every time we do not have to lament that we are very short of skilled people, we are losing them to greater attrition because of the high workload demands of COVID-19, and then we salute their memory, but we do little to correct the system. So I believe it's absolutely essential for us, while paying the tribute today, that we carry the resolve also to improve the system. So while the doctors are treating the patients, everybody else must unite to treat the system. Thank you.
Thank you so much, Professor Reddy. And you highlighted some of the really important aspects of this whole, the ecosystem which is supporting around us. And this also that, why doctors who are already vulnerable for many things, they are vulnerable for, the diseases they are treating, but at the same time, they being the face of our Indian healthcare sector or system or any healthcare system, they are the one who gets all the big bets of when the system fails them, or when something which is inherent in the system is not adequately functioning. The blame comes on these doctors, and at that point of time it is important that again what Dr. Guleria said, that we need to hear them as well, we need to protect them, we need to prepare them. And preparation is something which you rightly and you have requested Dr. Guleria and the entire, I think, the policy maker ecosystem to prepare them. And this preparation will come through the right kind of funding in the infrastructure, the right kind of training mechanism, and the right kind of protection mechanism as well. So I would also like to take out the other few words which you highlighted about, basically about care, concern, and courtesy, and compassion and communication, which is important for doctors. We do believe that the doctors need to exhibit this, and many of them are exhibiting this. And at the same time, I think all these things has to be reciprocated by the patient also. So as we are celebrating and commemorating the work of the entire health ecosystem, from doctors, nurses, paramedics, to also those who are in the labs, research centers, or at the plants of medicines, or involved in the supply chain of medicine. They are all doing wonderful work. And no matter whether it is a business or not, but at least it's a business of saving lives. And we want to salute this business of saving lives. We have almost 4,000 people watching us live on Facebook. So I want to request all of them to be part of this campaign. You can show your support for our doctors, for the entire healthcare ecosystem, and the workers, manning that, by signing the petition at change.org, the link for which is available in our FB page or on the comment box as well. And you can also go to the website at ihwcouncil.org to demand and to request that there should be something which keeps reminding us that we need a better support system for our healthcare system. And I believe once we as a public start appreciating the work of healthcare system, the policymakers will also start putting greater attention, greater resources, greater support for this healthcare system. So we need to start valuing our health and the system which protect that health. Thank you so much, Dr. Reddy, for your kind words and bringing back the memories of Dr. Vidhan Chandra Roy, on whose birthday we are beginning this initiative. And it was really wonderful to hear that despite becoming the Chief Minister of the state, he continued doing something which a doctor is meant for doing. And with this, I'll go ahead with our other panelists, and we have joined by Dr. Shuchin Bajaj, who is also co-founder and director of Ujala Cygnus Hospitals and Healthcare Services. Dr. Shuchin Bajaj is among the frontline COVID-19 warriors. He is one man, or he's the one who is also contributing our collective fight against this pandemic from the private sector, and has set up voluntarily given the hospital and the infrastructure as a COVID-19 dedicated hospital. Dr. Shuchin Bajaj, welcome you on this momentous initiative, and I would request to say a few words that how do you believe that we need to more compassionate about those who provide compassion and care to us.
Thank you very much, Kamal, for organizing this wonderful initiative. And warm greetings to all panelists and everybody who's seeing us on Facebook right now. I hear that there are more than 4,000 people here. So wonderful to see all of you spending time to come in and participate in the Gratitude Week for Doctors. I want to start out by again acknowledging and thanking all the doctors and the healthcare staff whose amazing passion and zeal has been unbelievable to see in the face of the battle that we cannot have chosen to walk away from. We've been forced to get into battle quite unprepared, even in the most advanced of countries over the last few weeks and few months. We saw healthcare systems crumbling. We saw shortage of PPE supplies. We saw shortage of medicine, drugs, shortage of ventilators. A lot of physical as well as mental stress for the healthcare workers who were trying to provide succor without having any arms, ammunition, and literally having their hands tied behind their backs. But it was amazing that nobody walked away. As Dr. Guleria also said, even the senior professors chose to stay on in their duties, even though they realized and they understood the most that they were at the risk. I don't think anybody knew more than them about the pandemic's effects on elderly population, but they still chose to be there. So we are all living through strange times, but and we did not choose to live in these times, but we do get to choose how we live through these times. And the way that the medical fraternity has responded to this challenge, I think just hats off to all of them. We run many hospitals, and we haven't seen any of our doctors or paramedical staff or nurses walking away from the duties or telling us that it is difficult to, even though many amongst us have become positive, many have fallen sick, but they've just come back as soon as they recovered and are eager to do their duties. So I would request all of you watching right now to understand how much of an issue it is. We really went unprepared into battle. As a hospital administrator myself, I can tell you that I had not heard of N95 masks or PPE kits or long boots. These were things that we started discovering when the pandemic hit us from nowhere. All we knew about was three-ply surgical masks and HIV counts. And suddenly the supply chains ran dry. We were scrambling to get the supplies together. All of us did duties, even surgeries, sometimes with cloth masks because we could not find even three-ply masks, let alone N95s at that time when the pandemic was beginning to hit us. But again, as I said, really proud of the way everyone's rallied together and just, gathered together all the resources we had and made it into a battle that which we hopefully are winning now. In spite of the fact that we had so many constraints, we did not know who the enemy was, what the enemy was capable of, and we certainly did not have any arms and ammunition to fight the enemy. But the speed with which we have responded, with which we have researched, with which we have built up our capabilities, both in terms of logistics, PPE kits, as well as in terms of medical knowledge, I think hats off to the medical fraternity. I don't think anybody else would have responded so quickly, so rapidly, and so effectively against any unknown entity that had hit humanity so hard. So thank you very much for gathering all of us together. And I hope you have a great event. I think it's one of a kind event. We've never heard of a 7-day long gratitude day. So thank you, Kapilji, and thank you, IHW, for doing it. And thank you, all of us, for participating in it.
Thank you so much, Dr. Shuchin. Your words means a lot, and also because you are the one who is leading the whole team of Ujala Cygnus, providing the real care, on the front line of this COVID-19 fight. And I'm sure that as a hospital administrator also, you are taking care of your doctors to the best possible manner. And as you said, that despite these personal protection kits or the mask or many other things which we are which has become a new normal and which has become so essential for us to operate in a healthcare system where hardly even noted before this pandemic, or it came to the notice of the people, and you have tried to put everything together, and the entire health ecosystem has helped in that. And not only those were outside the health ecosystem, they also started contributing in this time of pandemic. So we salute to all of them who made this fight possible, and the fight which we expect we are going to win, and we are quite hopeful that we are going to win this fight, and we are doing fairly well with the help of this whole military of our doctors and nurses and healthcare workers. I'd request now Dr. Hema Divakar. She is one of the the most passionate person I have come across when it comes to women's health, and she told me, and I'm sure even Dr. Randeep, Guleria, and everyone has to take care of so many things, and I'm really overwhelmed that all of you tried to achieve spare some time. She is going to maybe do the surgery post this session and come back, join us again during the day. Dr. Hema Divakar, at a time when the whole force, like in your body, when the stress come, the whole the immune system start fighting the something which is kind of invading your body. Similarly, right now the whole healthcare system is trying to combat this COVID-19. How you are ensuring that health reaches to the women also, these mothers also, which also cannot wait, and how these doctors are balancing it. You as a doctor is balancing these two responsibility at a time of pandemic. Dr. Hema Divakar.
Namaskar. We bring you greetings from ARTIST, which expands as Asian Research and Training Institute for Skill Transfer based out of Bengaluru. First of all, I must place on record my heartfelt thanks to Kamal Narayan and the entire team of Integrated Health and Wellness Council, because Doctors' Day, gratitude expressed on one day. But in the backdrop of the COVID-19 pandemic, Kamal thought and the council thought, one day is not enough. We have to extend this for the whole week, and it is the gratitude week they have put together and given us an opportunity to strike base with many of you who are watching this program and beyond. As you express your gratitude to us, we too express our gratitude to you for your trust, and of course the gratitude to the Almighty all the time, because these are the times of crisis where we fondly remember the saying from the Bhagavad Gita, Karmanye vadikaraste ma phaleshu kadachana. We are bound in our call for duty, but it does not mean that we are not bothered about the results. Sometimes the results are not in our hands. That is what the corona seems to, loud and clear tell us, because there are multiple facts which give us the outcome and end result. First of all, as has been mentioned, we as doctors and our entire team, which has been emphasized again and again, so we humbly accept the gratitude and thanks on behalf of the entire team. The second component is, of course, the presence of mind and the intuitive decisions and spur of the moment. There may be many things in the crisis that we may have to put our minds together and act upon it in a way which has to come from our sixth sense. So our own gratitude to that. And last of all, to all of you, the families, the patients, the society, all these are parts of the pieces of the puzzle, which ultimately give us the end result. Kamal also spoke about the memorial. Yes, this will not only stand in the memory of all those who have sacrificed, but it will also stand as a great testimony for two important adages which are ancient. One is to remind us that health is wealth. The other is to remind us that prevention is better than cure. Yes, dear friends, when you are COVID positive, of course you will land up at our doorstep and we can only do the best we can. But all of you know very well that what we are focusing and what we are telling everybody is prevention, to break the chain, to do your bit as a responsible person in the community to prevent the spread by way of everything that all our experts have kept on telling you. So responsible behavior from yourself and the focus on preventive care. Today also incidentally marks the launch of a YouTube channel by ourselves called Health for Her, because we do strongly believe that we want to reach every woman and every girl. And as has been told by Randeep ji, technology, yes, drives us to a methodology by which we can hope that the dream of reaching everybody actually comes true. The preventive care which COVID has taught us, several other things in women's healthcare which could have been prevented, and we are working on our vision on 5 things, A, B, C, D, E, which brings us back to basics. A for anemia and adolescent care, B for building contraceptive choices to prevent 15 million abortions that are happening. The preventive care, of course, is not to get pregnant and use contraception. C is cervical cancer. We are in the quest for COVID vaccine, but the vaccine which already exists for cervical cancer, we haven't reached it to enough number of people. D, diabetes. Srinath ji spoke about NCDs. Millions of diabetics in our country. Lot of opportunity for preventive care again. And E, the essential obstetric services, where when we say he died of contacting the COVID infection, it was so untimely. There are many mothers in the country who are dying at a much younger age with preventable causes. So the care for these mothers with quality, dignity, and respect by building the capacity of 1 million healthcare workers to take care of the 30 million deliveries that happen in our country. So we are also launching the Health and Wellbeing Champion Quiz during these 7 days, because it is just our attempt to sensitize all of you that really you ought to worry and pay attention to your own health, because your health is in your hands. So please help us to help you by doing your bit when we are allowed to do their bit. The only pandemic or the crisis situation which I have faced in my life is the HIV, as have also has been mentioned by the others. It was 2 decades ago. I was much younger then. The only private practitioner in the whole of South India who was ready to battle with this and take cases on for delivering the patients who are HIV positive. And everybody then said to me, oh, don't think you're Mother Teresa and don't think that somebody will give you a crown because you've treated these patients and build a memorial. But we have survived, and we look back with satisfaction for doing our bit in those crises. Here we are yet again promising to do our best bit and let the good memories of what the healthcare system has transformed into, because the trigger has been the crisis which is staring in front of us. With that, breaking the silos, getting all the sectors together, joining hands and believing that together we can. Thank you very, very much for this opportunity. Namaskar.
Thank you so much, Dr. Divakar, for your wonderful thoughts, and also we are really humbled to hear that what all you are doing to ensure that health reaches to every woman, every mother, and also that how you are trying to highlight that something which is very, very preventable. And this is one of the biggest problem, that while we are talking about COVID-19 and this pandemic, which most of the healthcare experts and even Dr. Guleria has also been time and again saying that does not have that kind of mortality. We are forgetting many other problems which kills us much more enough, and they are preventable. And so this is also the time for us to keep reminding ourselves that the role of doctors, the role of healthcare sector and the ecosystem is not limited to this pandemic. It is not momentary. It is something which is permanent. And we, echoing that thought, we are requesting the entire society to come in large, support, to show their respect, their appreciation for these people who are always there to save us and trying to save us. You said about that the entire industry, the whole ecosystem, and the people from different sector also need to come. We have today with us Mr. Rohit Poddar, who is the managing director of Poddar Housing and Development, one of the leading organizations from Mumbai. And we are really, privileged that he decided to support us in this cause. And we are thankful to him. It is also a hallmark that how people from different segment of businesses or society are coming forward to help the cause of health. And we believe that health is the most and primary, basic, fundamental thing before anything else. So no matter which industry, which profession, which type of life you are living, health is the most basic requirement for this. So thank you, Rohit Poddar, for joining us. And I would like to hear a note of gratitude from you for all our doctor community for whom you are supporting in this cause of Gratitude Week.
Thank you so much for this honor and privilege. I'm delighted to be to partake in this very important week as a representative of the Poddar Group, Poddar Foundation, in what we call the Dr. Sahib Day. Now, I would like everyone to know, being a civilian, why we call it Dr. Sahib Day. Is because I think the population at large understands that Dr. Sahibs, they selflessly provide a service to all of us as per the oath that they take to better our lives and to save our lives. And being a Marwadi, the joke in our community was, we never want to be a doctor or a politician, because we have absolutely no family life as a consequence of being a doctor. Because really, as Dr. Reddy said also, that they are on 24/7, and in this case, 366 days being a leap year. I would like to thank all the doctors, nurses, health workers, support staff. I think whenever there's a pandemic of this scale, which has really taken over the entire country's mind share, we are reminded of the fact that they are doing amazing service. They are risking their lives on a day-to-day basis for us, which we very easily forget. And I think that and I hope that the duration and severity of this pandemic will teach us a lifelong lesson. As a Indian, we believe in karma, in the Atma being eternal, life after death. And I think very often, as a consequence of this, we actually forget about disasters very fast, and we basically move on. But I really hope that we don't this time, because there are a lot of structural things that are required for us to solve this problem. The primary one being actually the percentage of GDP that we actually spend as a country on healthcare, which is actually abysmally low. And I really would like to encourage this platform to vociferously campaign our government to radically increase the budget for healthcare as well as education. Also, like everybody else said, this is a very preventable disease. So we would really like to encourage people to follow the Swachh Bharat campaign, not only in terms of personal hygiene, but also in terms of having a Swachh mind. This it's very apt that we're discussing holistic health at this point of time, because the better we have, the higher immunity that we actually have for ourselves, the easier we can actually fight pandemics like this in the future and put a lot less load on our healthcare system, which is already now overstretched and overburdened. So I would like to, encourage all our fellow Indians and countrymen. We have a very rich tradition of Ayurveda, homeopath medicine. We should not try to ape the West at all in terms of, what they have taught us in medicine, but really our history has taught us to basically have, holistic wealth and spirituality is a very big part of that. So I think that I really hope that this pandemic will teach us the lesson to go back to our roots, to basically to understand the concept of holistic health, mental health, all one, and us recognizing our very rich tradition, history, and competence in this. And we obviously want to get educated in the Western medicine as well, but we should not forget our roots. So on this note, I'd like to thank all the healthcare workers, all the Dr. Sahibs and Mem Sahibs. And it's a privilege for us to be associated with you. And I hope that we repeat this every week for the next many years. And thank you very much for the same.
Thank you so much, Mr. Poddar, for your kind words and also for highlighting how we have always been looking up to the doctors as our Dr. Sahab, who has always been there to help us, relieve from our pains, from sufferings. Any time when we fell sick, we went to these Dr. Sahibs, and they were always with us. Dr. Prakriti Poddar, to share your views and how you have been ensuring that all those who are in distress because of mental health challenges which the people of India or across the world are facing, and not only those, even doctors and the nurses and all the paramedics and healthcare staff too were facing these mental health challenges. How you came to the rescue of that, and what has been your experience and your gratitude for the doctors?
Thank you so much for having me on this amazing distinguished panel. I want to first recognize your endeavor to do this. It was, when you were speaking about it, I was like, no, we have to do this. This is so great, to be able to come out there and thank people that are tirelessly working for us. I mean, the true nature of the karma yoga is really coming out at this point. Of course, there is so much to talk about when it comes to the mental health of our caregivers, our medical professionals who've been working. I mean, we don't recognize the fact that this is a hypersensitive state. And we often, brave a front that is, that crushes the trauma within us. And then, at a later point, it comes out when things calm down. And we've seen this, and thank you for mentioning, what we've been doing. During this period, we started, I think, on the 19th of March and put up a helpline, a free helpline based in Delhi, but really was able to get volunteers from all over India to come and support this helpline, to train them in mental health, distress calling and relief to the people that call. And I was really surprised, but we had a lot of nursing staff also call us. In fact, we have a whole bunch of doctors, young professionals who have taken this as a mandate for themselves and are now promoting this across their group because they recognize the kind of stress that even the young doctors are going through, and they've provided this as a platform for them. I mean, I recognize every day the kind of burden of mental health. And this is like exactly the same as going into war. You're going into a combat zone. You know the risk, and yet you go ahead and you do that on an everyday basis. In Canada, we call this PTSD. I know a lot of doctors who are psychiatrists here sometimes they don't like the word PTSD and don't appreciate that and really call it just trauma, because there haven't been any studies that have been conclusive that everybody gets PTSD when they go through this. But it is a high stress job. There is trauma, especially when you see your colleagues who lose their life to it as well. There have been cases of people who have got corona, but they take it so badly that they have started committing suicide based on this. We've had a lot of cases in across India where once they recognize that they have corona, they start to self-harm. Just so that they don't give it to their families. And I know that the burden of really communicating, and I know that this was said before, really communicating as partners with your patients is important, because the mental health fallout of this pandemic is even greater than the physical health fallout. So I think that becomes a clear pivot on the journey of the doctors, where they've recognized now that not only do we have to support this physical aspect, but we have to build a support system where they recognize that this pandemic is not going to be fatal if you actually uplift yourself and utilize the kind of services that are being offered. And as was said before, of course, we don't have the perfect cure yet. So you have to have a mindset that's allowing you to fight for things. And even, like I said, for doctors too, even though, I'm talking quite closely with some of the doctors who are involved in psychiatric care, and they're also facing a lot of COVID patients, and they're managing to keep these isolation going for them. But every day, it's a question of how your staff is doing. Every day you're taking that ownership, because your family now isn't your immediate family only, but your family is also your colleagues who are under your care, and you're putting them out there, and they also are communicating with people who are at risk, and you then are at risk and their families are at risk. The circle gets larger and larger, and yet the protection of your mental health and the protection of mental health of your employees is so necessary. And there have been people who've gone out and said, let me do a webinar for mental health for our doctors, for our nurses, for our staff. And I think that's imperative at this point, because when we support the supporters who are supporting all of India, I think that there is a great chance to come across with the least amount of damage. There is going to be damage, but it's, at least we limit it, and we don't risk more than we need to, because we manage to put a spanner on the wheel and say, hey, let's stop this right now and understand, accept and accommodate for this high stress, access the capabilities that are out there that are supporting us, and utilize that as a support. For example, the Goa government took this as a mandate to say we want to use the Wellbeing Volunteers United helpline to make sure that anybody in Goa who has this issue or any other issue, because we haven't forgotten that mental health has been a burden in the past for India. 1 in 4 people had mental health illnesses of some sort in their lives, and we haven't forgotten that self-harm is number 14 on the list of death, and and disability for mental health is number 6. And of course, like we were talking about for insurance, mental health is not even part of insurance. We're saying that, okay, we're talking about health insurance, but this also comes into health insurance. It all has to go in sync, because we are a mind and body and spirit organism, and we need to respect and respond to that. And we know that every single one of us has a mind, body, and spirit. So none of us are exempt. Or somebody asked me, what about mental health immunity? And I was like, 1 second, what do you mean mental health immunity? You can have mental health best practices. Mental health immunity does not exist. We're all impacted by each other. And in fact, this particular pandemic, I find, is giving you a mirror to the fact that we're all impacted by each other. And we need to get back to our spiritual heritage to really understand what that means. That means we're not isolated. That means even though we're in isolation, we're still in an ecosystem that needs to support each other. And we need to take these lessons as a silver lining, really, to understand the impact of how society really is truly meant to function, and support each other in ways that we haven't before, and expand that. And I know that, as doctors, you've been the front line of doing this, of being able to go beyond your call of duty, to be able to, put your personal issues aside and focus just on this high stress job. And I really love the opportunity to thank you all profusely for doing that, because without you, without the system of well-being warriors, because I have the well-being volunteers, but you really are the well-being warriors that are going ahead and taking, putting India in your arms and lifting them up. And I really thank you from the bottom of my heart for doing that, for easing our stress and distress, and for spreading this kind of support. And it really, humbles me, and I feel blessed to be able to be here. Thank you so much for having me.
Thank you so much, Dr. Prakriti Poddar. And we have seen your work, which you have been doing in the mental health area. And as you rightly highlighted, from doctors to nurses, everyone has faced this problem. Many of them have faced this problem, and we need to have a support system for that also. And you tried to build that. It was really a great initiative, and thank you so much for doing that. Thank you so much, Dr. Randeep Guleria, for your time. My heartfelt gratitudes for you, Dr. and Professor Srinath Reddy. Thank you so much for joining on a short notice. And Dr. Shuchin Bajaj, Dr. Hema Divakar, Mr. Rohit Poddar, Prakriti Poddar, for all your support. You people made this initiative possible. And I believe that from here, we will be able to get more support from people across the nation, from the industry, to make this Gratitude Week a permanent occasion of celebrating this selfless work of millions of healthcare and associated workforce every year. And I look forward to host you all again, maybe when we will have an opportunity to do and celebrate it in a physical environment.